PICO question. Do nurses who work 8-hour shifts in an acute care setting have a lower occurrence of adverse events for patients and employees, as well as a lower occurrence of medication errors in patient care than nurses who work 12-hour shifts?
All right, I have your antibiotic for you. There you go.
Code blue.
The patient's crashing. Start CPR.
5 minutes later, this patient went into cardiac arrest. Findings were that the nurse forgot to look at the patient's allergy history and hung the wrong antibiotic. This nurse also forgot to ID the patient, and the antibiotic was meant for a different patient.
Call Lisa. Lisa, thank you for coming. I am needing a break now. I'm so tired of this 12-hour shift. I've been working overtime, and do you mind just watching my patient for an hour?
Of course.
Okay, he needs vital signs, and I really don't even know what else.
All right.
5 minutes later, the nurse took the vitals and noticed the patient was showing signs of hyperglycemia. The 0800 insulin shot was not given, nor were the vitals ever taken that morning. The burned-out nurse was too engulfed in her own frustration that she missed her morning assessment of her patient.
Are you ready to get report? I'm going to get report on room 12.
Okay. It's so great to be back after 2 days rest.
I know, I love working at this hospital.
The signing-on nurse has just worked an 8-hour shift. She gave the SBAR report to the 12-hour shift nurse, who has only worked one 12-hour shift this week with no overtime, is well rested, and is happy. Patient care is a success.
So I wanted to call y'all in today for a very important meeting, and I just wanted to go over a few things. Studies lately have reviewed that irregular schedules can negatively impact the health of healthcare professionals such as you, particularly women such as you. Fatigue and nervousness are the most frequently reported mental health problems of healthcare professionals. Emotional exhaustion and stress may be the leading reason why nurses burn out. This burnout can lead to errors in patient care, especially if you're exhausted from working either irregular schedules or too many hours, too many days in a row. So as nurse manager, I want to ask y'all a few questions, and y'all can just raise your hand or feel free to, contribute. But how often do you purposely know you're too tired to come to work, but you come anyway?
Every day.
Yeah? Show of hands? Yeah, okay. And how many errors have you realized you've made during your shift?
Lots.
That's what I thought. And are these med errors, charting errors, or unintentional self-harm, such as maybe sticking yourself with a needle?
I think I've done all. How about you, Lisa?
Yeah. Okay. And how many of these errors do you even remember making?
None. Sometimes I don't remember.
And lastly, when you do remember making them, do you ever document them?
They're going to fire us if we do that.
No, well, that's a good thing. You always need to document your errors. There's still many studies that need to be done to assess how shift lengths affect patient care. Questions regarding days worked in a week versus hours worked is an avenue still needing to be researched. And quantifying the proper number of hours sleep that is successful for patient care also needs to be looked at. Researchers also need to study effective ways to manage fatigue on the job that they have worked in occupations such as pilots, truck drivers, so that still needs to be looked at. But in the meantime, there are 2 tools you can fill out that have been recommended to assess you. And here we have the Pittsburgh Sleep Quality Index and the Occupational Fatigue Exhaustion Recovery Tool. And these just evaluate how you're doing as far as exhaustion and your sleep habits in the last month. They can provide you answers that you may not have realized on your own and how they can possibly be affecting your patient care. So is this something that y'all might want to fill out?
Sure.
Definitely.
The point is, we all have our preferences as to which shift length we prefer. Some of you say you like 12 hours. Some of you say you like 8-hour shifts and are more satisfied that way. What we do know is that more errors in patient care are likely to happen when you start working over 12 hours consecutively and if you're tired and exhausted during your work. So it's even more important to stop and self-assess your quality of work and if you're emotionally able to take care of your patients. Also, you're responsible for those sitting around you now. And if you notice any of coworkers making a mistake or are too tired to take care of their patients, you need to report them immediately to your nurse manager. And also, I see absenteeism happening, and for those who are working overtime, so I just want you all to be aware of what's going on at work and just kind of do some self-assessment. Is that okay?
Yeah. Thank you.
You're welcome.
오빤 강남스타일 강남스타일 낮에는 따사로운 인간적인 여자 커피 한 잔에 여유를 아는 품격 있는 여자 밤이 오면 심장이 뜨거워지는 여자 그런 반전 있는 여자 너는 선호해 낮에는 너만큼 따사로운 그런 선호해 커피 식기도 전에 원샷 때리는 선호해 밤이 오면 심장이 터져버리는 선호해 그런 선호해 아름다워 사랑스러워 그래 너 hey. 그래 바로 너 hey. 아름다워 사랑스러워 그래 너 hey. 그래 바로 너 hey. 지금부터 갈 때까지 가볼까 오빤 강남스타일
Thank you.